My name's Anita Bark, and I'm the co-chair of the ACHA COVID-19 Task Force. And I'm pleased to host this presentation on vaccinations from the COVID-19 Task Force's updated guidance for fall 2022. I'm here with Dr. Giang Nguyen, Associate Provost for Campus Health and Wellbeing and Executive Director of Harvard University Health Services. Dr. Nguyen is a member of our COVID-19 task force and authored the section of the guidelines on vaccinations. Giang, thank you so much for joining us today. We look forward to hearing the important points and takeaways from the guidelines that you've written on vaccinations.
Anita, thanks for having me. It's my pleasure to be here. Just to clarify, I am speaking on behalf of the COVID-19 Task Force and ACHA, and not on behalf of Harvard, although we are, of course, supportive of these guidelines. So I'll just go through a few key points that I think are important for us to take away from the guidelines that the COVID-19 Task Force put together. And first of the list is the guidance on vaccination. We follow the CDC's definition of what it means to be up to date. And we'll include a link to the CDC website that provides a definition rather than putting up on the slide here, because the definition does depend on your age, as well as the duration of time that has elapsed since your last COVID-19 vaccination. So I would refer you to the CDC's definition in order to determine whether a community member is up to date. But we recommend that at minimum, campuses strongly recommend that all community members are up to date on COVID-19 vaccinations based on these definitions. Now, if your campus is able to incorporate these recommendations into existing vaccine requirements, that would certainly be of great benefit to improving the vaccine rates and the protection of your community. But we definitely say that campuses should at least strongly recommend that that everyone is up to date. In order to improve vaccination rates and to ensure that folks are getting boosted when they are eligible, we also recommend that campuses leverage any trusted voices that are on campus in order to increase this message. And wherever possible, as I mentioned before, we should integrate COVID-19 vaccine into any existing vaccine requirements and protocols. And finally, it's just good to remember that natural infection is not a substitution for immunization. There are many members of our communities who have had some form of natural infection over the past couple of years. This is not a substitution for getting vaccinated, and we do advise that folks who have had natural infection also follow the CDC guidelines for immunization as well. So I hope that this information is helpful to you as you plan your campus activities in the coming months. And this will help ensure that as many people as possible are protected through vaccination.
Thank you so much for joining us today, Giang, and thank you for sharing these important points with our audience. Many thanks to you and our audience for watching this video. If you haven't accessed the updated ACHA fall guidelines, you can find these and other resources on the ACHA website. If you have specific questions, you can email us at contact@acha.org. And if you'd like to join the discussion on this and other COVID-related issues, go to ACHA Connect. Thank you again for joining us.